I am a chief general surgery resident on trauma surgery. Woke up at 5 this morning. Around 5:30, I drove over to the hospital. I actually got coffee this morning. I'm so proud of myself. Got up in time for that. It's a Christmas miracle. Doing a 24-hour shift today. So I went over to the call room and I just dumped my stuff in there. I bring a bunch of toiletries in hopes that I'll actually get to use them, but rarely have. Grab my little protein shake. Then, of course, they called an airway alert, but the patient was able to be intubated. In case they can't intubate, that's when we have to do a surgical airway. Cut into a patient's neck and put a tube in. I grabbed a little lemon ginger shot, drank that, went over to the operating room because we had cases this morning. Today we had a big case on a patient that's very sick on ECMO. So we did this surgery in the cardiac room, which is honestly the nicest OR in the hospital. After this, I called my intern and checked in. She'd seen some consults. She was seeing a trauma, so I went down to the trauma bay. There were a couple level 2 traumas and then a level 1, all of which were stable. So then I went back to a computer, worked on some post-operative orders, op notes. Then I went back to the operating room and we did a cholecystectomy. We took out a patient's gallbladder. That went well. Afterwards, I checked in with my intern again. We saw some consults. I went back to the call room. I reviewed some patient charts to make sure that everybody was good and stable and followed up on some imaging. We also covered general surgery, so we saw some more consults during the night, a couple level 2s. At 6 a.m. I signed out and then I headed on home.